Good afternoon, good evening, everybody. Welcome. My name is Peter Gulka. I am a volunteer board member with the Psychedelic Association of Canada, and I'm going to be your host this evening. The PAC is Canada's largest psychedelics community with over 800 members across the country, and our mission is to educate and advocate to make psychedelic medicines available to all Canadians. And as an organization, we're just a little more than 2 years old. And by this point, we've got some really solid wins under our belt, working with Health Canada in conversation to attain access to psilocybin for certain patient groups through the SAP program, a 14,000 signature petition that was raised in the House of Commons, and commissioning a Nanos poll that shows 78% of Canadians support psilocybin for end-of-life patients. So all of these are examples of work that we're doing to increase and elevate the conversation across the country, particularly from an advocacy perspective, to make these medicines more accessible for people. And that's what brings us here tonight, is a conversation about one specific jurisdiction and some changes that are new. We're in a landscape that we haven't seen before. So today's event is one of many things that are happening in PAC's community. And so I'd encourage you to go to psychedelicAssociation.net, consider signing up as a member, and you'll get access to these webinars and advance notification of them. And you can also support the PAC through your membership. And we're grateful that you're here. Thank you for coming. So today we are talking about the upcoming regulations, or actually the enacted regulatory changes in Alberta when it comes to psychedelic assisted psychotherapy. And so we've assembled a group of folks today to help us to navigate what these regulatory changes are and what the implications of them might be. So let me pull up my document here. So with us is David Harder. David has worked full-time for the past 5 years in researching, advocacy, and moving the work of non-ordinary state therapy and psychedelic medicine forward in Canada. David is the co-CEO of ATMA Journey Centers, who run medical training programs for psychedelic-assisted psychotherapy based out of Calgary. With us also Simon Colgan, who is a full-time palliative care physician and clinical assistant professor with the Department of Oncology at the University of Calgary. And Simon works with a combination of community and tertiary level care palliative medicine. And Simon is also based out of Calgary. And with us as well as Tanya Craig, who is the executive director at Bloom Psychedelic Therapy and Research Center, and has over 9 years of experience in private practice with a focus on relationships and trauma. And part of that training is ATMA's psychedelic psychotherapy training. I myself live and work in High River, which is a town just south of Calgary. So we have assembled an Alberta crew here to discuss and debate the regulatory changes that Alberta has put forward, unique amongst provinces in Canada to this point. And so to set the stage, we really want to get a bit of an understanding of, well, what are these regulatory changes? What's true? What isn't true? What has been a bit confusing? And so with that, we will turn it over to David to give us a quick presentation on the basics of these regulations, and that'll set the stage for our conversation.
Thank you. I did a short slide pull from the regulations itself, and just separating facts from fiction. And it's not exhaustive. So if you want to actually read the full regulations, you need to go to the site in CanLii, I believe is called CANLII.org. And there is the full regulations there. You can read through it. And also the standards have been released, which is kind of the regulatory marching orders for this regulation. But what I wanted to do is just go through kind of a highlight of what things really impact the work that we do in psychedelic therapy. So I'm not going to read through all these slides, and these slides are available for anyone if you want these, or to go directly to the source, you get the full meal deal there. But in October, they announced that they were opening up regulations, and there was a lot of announcements that said Alberta's opening up for psychedelics. They did add regulations to what is really a Health Canada, and my previous slide, who really is the boss, Health Canada or provincial regulations? And the answer, of course, is yes, both, because Health Canada determines which medicines can be legally used. The province decides how those are rolled out through the medical systems. And so Alberta came out with regulations defining how these would be used in Alberta. However, Canada, this slide here describes how Health Canada just decides which drugs are being used. And right now, this goes through the different medicines that are considered psychedelics and others, MDMA and ketamine, which aren't classic psychedelics, but that are considered psychedelics in this conversation. So this kind of goes through which ones are allowed and how they're allowed to be used. And since the slide was created just last week, today we found out that there was two SAPs granted in Saskatchewan for PTSD. So things are changing almost every day right now. So then it goes through service requirements. If it includes a psychedelic assisted psychotherapy or is a psychedelic dose of a drug other than ketamine, then, and it goes through some of the rules that are there. It must be prescribed by a psychiatrist or physician in consult with the psychiatrist. This is probably the biggest thing that we need to be aware of in terms of what the regulations require. And what I wanted to do really quick is just paint a comparison to what happened in Oregon, which is where they said anyone with a high school diploma and a 160-hour training program that they very clearly articulate what needs to be covered could open up a clinic in Oregon. And that took place January 1st of this year. So they're in the applying stages right now. And within, we believe, probably 5 months, there'll be clinics opening up in Oregon. And there, it's, like I said, just a high school diploma with a very specific training in psychedelics. And those clinics are not to be therapy clinics. They're just treatment clinics. So I can fly down to Portland as soon as these clinics open. I don't need a prescription. I don't need a psychiatrist. I don't need any medical I don't know what kind of intakes these clinics will have. I'm sure they'll have some requirements in terms of filling out forms and waivers, but then I can get the treatment in those clinics. What I do before and after that is completely up to me as a patient. In Alberta, it must be done by a visit to a psychiatrist to get that consultation, and then the treatment must be administered in a facility that is overseen by a psychiatrist as a chief medical officer, and then the people that are actually treating, I'll jump to this next slide, must be one of these 6 colleges: occupational therapists, surgeons and physicians, psychologists, registered nurses, psychiatric nurses, and College of Social Workers. So it is a very different model, and just trying to get the facts on the table so our conversation can have some meat. And then the next one, if it does not include a psychedelic dose and does not include psychedelic assisted psychotherapy, then it gives another list of requirements. And it almost feels like, and I'd love to have a conversation with the rest of the panel here, but it feels like they've opened up the door for microdosing to not be covered by this, which I found was interesting. So this is the real kicker to me, is that only a psychiatrist or a physician in consultation with a psychiatrist can prescribe a psychedelic drug for the purpose of treating a psychiatric disorder, unless the drug is ketamine provided outside of psychedelic assisted psychotherapy. So those are straight from the horse's mouth. And this, again, a medical director is a psychiatrist appointed by the licensed service provider to oversee all clinically related aspects of the licensed services. And this is directly from the actual standards that if you go to this CanLII website, you can actually see all of these specific. Prescribers must ensure all prescriptions provide the following information. Respecting the quality of the drug must be dispensed or sold at any one time. The intervals of time between each dispensation or sale. Information about the dosage, whether the drug is to be used in the context of psychedelic assisted psychotherapy. And then what are the requirements? And again, license is not required. This is where it gets into what I thought was microdose. Treatment is part of an approved clinical research trial, or offering ketamine outside of psychedelic assisted therapy, or dispensing or selling psychedelic drugs for use through a licensed service provider. And again, some requirements on the right side there. So that is just a really quick overview of the Alberta regs, and I'll leave it, looking forward to the conversation with the rest of our panel to digest this a bit more and see where this lands for you guys.
Awesome, thank you. So this gets us into some really potentially interesting territories where the conversation that I've been part of, there's a lot of confusion as to what the implications of this are. And one of the biggest ones that's come up is, does this mean that psychedelics or psychedelic assisted psychotherapy are legal in Alberta?
No, not at all.
So this is important, I think, to again set the stage. We have Health Canada as an umbrella that because it's MDMA and psilocybin, for example, are in a clinical trial process, they don't yet have a drug identification number that a doctor can use to prescribe. Therefore, the regulations from one perspective, they don't mean anything until Health Canada comes around.
Correct.
Okay. Now, Tanya, something that I really wanted to get into with you from your work in Bloom, and there's other ketamine clinics in Calgary, these regulations list ketamine, which is already a substance that is used in clinical settings. What's your impression of how these changes in regulations would affect that side of the table?
Mm-hmm. So further to what David is saying too is, in a sense, what it's doing is restricting who can prescribe it. And the area that it's not restricting is the area that I think we need the most public safety in and the regulations to actually come forth. And it's in education for those prescribing. So for example, I had a phone call yesterday at our clinic, and a gal had been prescribed by a psychiatrist in Red Deer ketamine to take home as a sublingual dose, so lozenger. And she was in tears because she didn't have any understanding as to what she's supposed to be doing with this. Now, of course, this is from her point of view. We don't know from this other doctor. But my point is that the regulations restrict specifically ketamine as a psychedelic use and ketamine in conjunction with psychostherapy. It doesn't affect ketamine as it's used for pain control or other means like prescribing it at home. And I think that is a huge disservice to public safety. Ketamine as any psychedelic, the most important aspect is setting, emotional safety, and integration, helping people understand what they're opening up to. And just to continue one more piece there is also to have an accurate and appropriate intake process that would largely involve the practitioner having experience with the substance itself, not having someone who is just simply a credentialed individual that now can prescribe or administer therapy without ever having experienced psychedelics themselves. It is very, very hard to have any understanding as to what your client is going through if you haven't experienced some aspect of that.
Awesome, thank you. We sort of gone back and forth in the direction we want this webinar to take, and one of the things that we want to find a way to communicate effectively is that Alberta, as the first province in the country to put forward a regulatory structure like this to directly address psychedelic assisted psychotherapy like this, would have thought it would be BC, but it ends up being Alberta. There's good intent here. From my perspective, personally, there's good intent here. There is maybe some work that can be done on the regulations, but I want to kind of take a moment to say, what are the things that have jumped out to you as the possibilities or maybe the positive aspects of what this opens in terms of conversation?
It brought a lot of light to the field, I would say. Beyond that, the regulations I don't see any positive in what they've done. But it brought a lot of light to the subject. Mm-hmm. Lots of people are talking about it. Lots of people are taking education. Lots of people are noticing that this is a thing. It's actually being discussed. So that is positive. The actual regulations, I do not see anything positive. It'd be better if we did not have any regulations around it than what has been brought forward. That's my opinion.
I see Simon still thinking there.
Well, I mean, I totally, obviously, I'm coming from a very medical background, of course, with licensure and things. I commend that the conversation has begun. I think that's definitely, as Peter says, it's a step forward. I definitely reiterate what Tanya was saying about having experience of psychedelics. I think that's hugely important. For us as physicians, it's quite new, so there's certainly there's a lot of stuff going on in the background about these guidelines, but it'll be very interesting what they actually look like when they're rolled out. I do worry sometimes just about the amount of work that will involve, even just for psychiatry, to actually be doing all of the the intake, if that's what is. So I do I do wonder about that, how that will look. I also wonder about clinic space, and if it has to be at a medical facility, what that actually looks like. So that concerns me, that those sort of things could potentially cause more barriers to people. But I think we're just unclear what the guidelines mean at the moment, and that's really what I'm struggling a little bit with at the moment.
Yeah, I piggyback on that. So I agree with both of them that, well, all of you, that it's great that it's being discussed. It's fantastic. There is a lot of misinformation out there. I'm noticing a lot of questions as to how do I get trained? Where do I go? So there's people that are really interested in pursuing this as a career path, which is fantastic. This being psychotherapy, or sorry, psychedelic assisted psychotherapy. Further to what Simon's saying is what we've discovered at Bloom as well. We have a psychiatrist that is our medical director. We have a psychiatrist that does our assessments. And we also have our medical doctors that do our assessments. So we've got a very robust team. And at the same time, even with the regulations that are available by our regulatory body, which is the College of Physician Surgeons of Alberta, it's still unknown and it's limited, and it's a lot of gray area. And the amount of work that it's going to take to actually have appropriate, well-rounded, accessible, effective, and safe regulations, that's not something to be rushed. And that's something that we need many, many people to the table. Like, not just psychiatrists and psychologists at that table. We need many professions, many experiences, especially those that have a background with psychedelics.
That was one of my concerns too, is how quickly it was rushed on the last day of our premier's office. So it was really, yeah, very, very unclear as to who they consulted. And I totally agree with you, Tanya. It should have been a broader base. It should have taken more time, but it was a rushed thing to get through on Kenny's last day of office, which is deeply concerning.
Given that, knock wood, there's likely to be a spring election in Alberta, do you see the election itself having an impact on how these regulations are implemented, or if they're implemented at all prior to that election?
You're asking us to get political. I'm going to defer to Simon for this one.
That is not something I feel either confident or I guess experienced enough to say. But no, but I still want to reiterate that the conversation has started. Even the fact that we're having this conversation is something, and I do apologize to people listening that we can sound vague at times, but it's really not clear, particularly for the physicians, and certainly from the Royal College of Surgeons. Again, we haven't had clear guidelines of. So I know there's a lot of physicians who are particularly interested, but I think there's a lot of fear and misunderstanding about what that actually looks like, which again, as Tanya was saying, is I think there needs to be a lot more people involved, and a lot more people, not just physicians, but many other disciplines. Mm-hmm. So yeah, I feel I want to apologize for being vague, but it's just that we just don't really know at this stage.
And that's really an important thing, I think, to even notice and name, that, like, the discomfort around this. And Mark Goldgrub, an attorney who works in this space, has put something in the Q&A that adds to this conversation, where I had mentioned that, until Health Canada gives MDMA a drug identification number, it can't be prescribed by a doctor anywhere across Canada. But it's more than the absence of a drug identification number. These substances that we're talking about are listed under the Controlled Drugs and Substances Act. So it's more than the absence of something. There is definitely a criminal element to this if those substances are worked with. And so the discomfort in this space for anybody that is in a sort of a regulatory body, your license is at risk. So you're up against this wall that people could be forced into the underground space to do this without the regulations taking into account the ability to work above board, which is, it creates this tension, it creates this difficulty in having the conversation. So with that as kind of a stage setting, when regulations like this come out, we would hope that there is an intent to increase access, to increase the ability of something that anybody who come here is like we're preaching to the choir. These are substances that are going to help in this kind of work. The bottlenecks that the regulations have introduced have been talked about. So what are the bottlenecks that you see in these regulations as they've been introduced so far in terms of access to care?
Well, I was quoted in a Calgary Herald article saying that only 5% of psychiatrists would be able to prescribe this, which I did not tell the reporter this. So if any of you saw that article, I did not say that. But I do believe that there's probably 5 or 10% of psychiatrists across Alberta that would actually be willing to talk about psychedelics, let alone prescribe it. And so now you've got 6 to 18-month wait lists for current psychiatry work. And now you're going to add another bottleneck of only a small percentage of those, we don't know the number, but only a small percentage of those are going to be willing to prescribe psychedelics because they just don't know what they do. And they're not aware of this. And like Tanya was saying about education, there's no real education required by psychiatrists in this model. And so are you going to have psychiatrists prescribing LSD at 1,200 micrograms for somebody with treatment-resistant depression with no care of how that's going to be treated? Like, how is this going to be rolled out? I just don't see any consultation or thought from the psychedelic community. People like Pam Kriska would be great if they had her on this board, or people like, there's so many in this industry, Tony Bosses, people from the US that have been doing trials for 15 years. There's so many people they could have gone to rather than just the psychiatrists within Alberta who have never worked with this legally because it's illegal to do so. So I feel like there's so many things that were missed in these regulations that it's going to be really an accessibility problem. It's basically impossible to get treatment in this current regime.
Simon, for you, maybe you can speak to it as from more of a firsthand experience perspective. What, if any, are the implications of reduced access to these in the palliative care work that you do?
I mean, I don't think there's any doubt that there is a huge interest and desire to use these medications, because I think a lot of people already have a lot of information from what they read. So I certainly get asked quite a few times. Of course, I can't speak for psychiatry because the vast majority of people I work with are end of life, and certainly psychiatry is integrated into that, but a lot of it is existential suffering. I know personally for myself and for others, we, because there's difficulty accessing, and at the moment, my ability to direct people towards getting that sort of intervention is very tricky. And I do agree with Tanya that sometimes you are driving people sometimes to experiment on their own, experiment with others. And I do have some issues with that, because they are very powerful drugs and should be used alongside people who are very experienced. But I certainly see a huge amount of existential suffering, and I would love to have more access to help people, because I think the transcendent possibilities when you're faced with your own mortality is immense. And I know that the ability we have to treat those things at the end of life are very limited. We don't have a lot of access to clinical psychology and even to psychiatry. I mean, a lot of these things are very limited, and I know a lot of my colleagues really struggle dealing with existential suffering. It's very, very hard to witness. So I think, personally for me, I would love to have more tools to be able to help people. So of course, any guidelines or any things that come, you're always wondering, like, is that going to make it easier, or is it going to make it more challenging? I'm very interested to see what they say about clinical space and what that actually means, and is that an AHS facility? That would be Alberta Health Services here, obviously. Is that what they mean, or are they talking about clinic spaces elsewhere in the city and or in other places? So, yeah, I think the need is great, Peter, and but again, at least the conversation has started, I think, at this stage, you know.
Thank you. And Tanya, I'd like to toss that sort of question to you about the space. That came in as a question in the chat as well. And if you have questions, please put them in the Q&A. We got a bunch and we'll start diving into them. Someone asks, I look through the regulations. I do not see a definition of what the province considers a clinic where these services can be offered, and what is their working definition. Have any of you applied for your license yet, and what questions did they ask about your space? So Tanya, I'm curious for you, going through the process already to get Bloom up and running, what does clinic mean?
Again, we're not clear as far as the regulations go. And we've been waiting since October to find information as to how can we apply for this license. My medical director, myself, my founder, we've all been peppering the Alberta government to find out what do we need to do. We're ready. We have everything ready. I can speak to that we've poured over the documents as well to find out what is defined. Like, does it need to be CPSA certified? What does it need to look like? And it's just not clear. Yeah, and I'm hoping, you know, in the actual benefit to the public when we're utilizing psychedelics, I really hope that they do consider considerations as to what are important for that setting. Because to have somebody come in, and this is the thing that really gets my goat, are the biomedical models in North America, where people go into a regular clinic space, they dose them with ketamine right now and walk away. And I see that as an opportunity for incredible harm. I see that as an opportunity for missed healing. And it's very easy to be able to implement aspects for emotional safety and for actual therapeutic growth. And that includes the setting. So that includes like just decor, consideration of the ambiance, and definitely the mindset is critical for that, but that's a different topic.
Really interesting conversation with Tony Bossis yesterday, the day before, on is there a third way? Like, we have this medical model and the underground model, and it's like, is there another way? And it might take, he says it's going to take centuries for us to evolve to this place. But where's wellness and wholeness and mindfulness and all these things that so go with psychedelic therapy that don't fit in the medical model, that do fit in the shamanic models many times, but not in the Western way that we live now in our societies and cities. So is there another way that we need to be looking at how these medicines should be rolled out? I think Oregon got closer to that. Some on the medical side have quite a few concerns about safety because there's so few regulations around it. But is there another whole body in the middle of, you know, the medical, psychiatric doctors and psychologists and the shamans? Like, is there something that we need to be exploring as an industry, and how do we roll these out? Because really, this is a spiritual journey. It's not a medical journey. Yes, there's biological things happening and pharmacological neurons that are being shifted, but by and large, the growth and the healing comes through that spiritual growth that we encounter in these medicines. So why are we not addressing that in the regulations? It's kind of forcing something into a box that doesn't really fit, but I feel like that's where we need to be spending time having conversations.
Mm-hmm. That's one thing that I'm really excited that I've had such great mentors in this field, is we have designed a model that is somewhat in the middle. So we definitely have the medical side, but we dose our individuals in group setting, and we modeled that after Roots to Thrive out on the island and Polaris Insight. And they, you know, especially Shannon Dames, she had the elders come in, and she does incorporate those aspects. And I just give huge hats off to how they run things. And part of what I'm seeing happen with these regulations specifically is it seems to be targeting certain clinics and certain operations. And instead of us now collaborating and coming together to be able to utilize what are we all learning, because this is all new. This is within the last 20 years that this is used in a clinical setting with ketamine anyway. And we need to collaborate. We need to be chatting about how can we bring in multiple models, and how do we include spirituality? How do we include the whole picture and have safety with medicine?
Mhm.
One of the questions that's come in through the chat is something that I personally haven't seen as part of the conversation around the regulations, is what structures would you like to see in place in terms of accountability for ethical issues, concerns, or violations in the space?
Well, I think for me, the first thing that pops up is first and foremost, I guess a panel, a board that has experience and from multiple backgrounds. Like if anyone's going to be judging what is ethical in this space, we need to have people from a shamanic background. We need to have people from a medical background. We definitely need to have a lot of education on informed touch consent. There's a lot of aspects that aren't clearly delivered in a lot of training programs that are all inclusive. So it is about bringing multiple backgrounds together, I believe.
And somebody mentioned, I probably meant indigenous, not shamanic. I probably meant both, actually. Yes, bringing in the indigenous wisdom to these circles as well in a good way is really important.
Yeah, I think I would reiterate that as well too. From I think we're certainly accused in medicine of being very colonial and very. I think we've a lot to learn in medicine in many ways that we treat people. So I really like what you're saying about the spirituality part of it. And going back to the existential suffering that we see, I know personally, and I'm sure a lot of my colleagues would agree, that a medical approach to existential suffering never really cuts it. And it is a spiritual crisis in many ways. And so for those two reasons, I agree that to have that kind of spirituality experience when it comes to guidelines. But actually, I deeply believe that indigenous ways of knowing have to be part of this as well too, because they've had centuries of using psychedelics, right? So I think that's an extremely good point.
It brings in another interesting question along that line. What is being done by the powers which drive the direction of this field in order to understand the general people's needs, wants, and feelings around psychedelic psychotherapy? If anything, I know there's a lot of public outreach going on to give the people an awareness of the power of these treatments, but what is being done and could be done better in order to hear the voices of Canadians and Albertans? It should be more of a public consensus which drives new regulations. So when we talk about adding in these layers of indigenous or shamanic practice or community-based practice, which could be called underground, is there or has there been an impression specifically to these regulations of those voices being consulted?
Yeah, to Tanya's point before, I believe that these regulations were driven through without nearly enough consultation or time. I remember listening to Tom Eckhart give a speech at Spirit Plant Medicine. I think it was 2018 or even earlier. And they were working on these regs then. And it took years for them to develop that for Oregon before that was made law, before it went to a vote. And this came through all of a sudden, all of us were surprised. Like there was a few people I know that were on the committee, but it was really not consulted to the people that know this work. And so, and let alone indigenous elders or people that have worked with these medicines for centuries. There was just really a medical psychiatric point of view that drove the ship through. And I feel like the positive side for me is I don't believe it's going to stand up to Peter's point about the election. I don't believe this is going to be the Alberta law long term. I think it's going to get changed or scrapped and rewritten. At least that is my hope.
Well, further to that too, like I agree with that. I want to take it a slight different way is with these regulations, it's limiting who can access it as far as wellness. So if you, right now, as it stands, at least for ketamine treatment, you have to use this as a second or a third line treatment. So you have to have tried therapy or you have to have tried pharmacology. The vast majority of people that I see in this clinic are people who have tried the pharmacology before, and it hasn't worked. And I think there's a huge disservice because there is so much gain and prevention that can happen for people who have access to psychedelics that are well, that don't have a diagnosis, and that are facing their own existential crisis, even without terminal illness, that are dealing with relationship crisis that is well known that when you're dealing with that, you're 40% less productive at work. So it just has a huge ripple effect. And right now, the only way you can access this is if you have treatment resistant and then give your acronyms.
Yeah.
It's a question that touches on that specifically. Has there been any word from Health Canada? It would seem that the CDSA must provide an exemption or amend an existing exemption before there's any change. There's an exemption for medical director of clinics. However, psilocybin is not mentioned. So it would seem until approval is granted federally, we're using the existing SAP program as is. So I guess the question is, has there been any comment from Health Canada about the Alberta regulations? And to my knowledge, no.
We reached out to Health Canada the day after it was announced, and they didn't know what had been done. So they're from the CDSA, from that department.
Okay.
And they're like, what regulations?
There are many indications for which psychedelics may facilitate either a therapeutic response or optimization of wellness, though grief, loss, dying, etc. are suffering laden. They're not psychiatric conditions per se, nor should they be classified as such. Should such indications be subject to these guidelines, in the opinion of the panel? So these guidelines right now, at a surface level, really are that term, psychedelic assisted psychotherapy. And yes, there's also the existing implications on ketamine clinics. But they seem to be very specific on that term being the target of them, to the exclusion of anything else. So should those guidelines be widened to include these other kinds of things like grief, loss, dying, optimization of wellness, in your opinions?
It's such a tricky topic, and we've been just struggling with this since I first consumed my first mushroom. Like, release it, let everybody have mushrooms and LSD and all these things, and we're going to have disasters. We have a society that's not mature enough to handle these medicines. That's the reality of it, in my opinion. And yet, is it our right to put in our minds what we believe is going to help us spiritually grow? Yes. So there's the two train tracks that we ride on, and somehow we have to balance this. Regulations to protect the people, yes. Overregulated, and you're infringing on freedom and spirituality and rights to the access to our minds. And so both of those things live big in everybody who's really, really sought after, how do we work this through? And I think, the more I look at what Oregon's done, the more I'm ready to pack up and move back to Portland.
For that one, I want to take off my sort of host board member hat for a second and just talk as a human. I see absolutely there is a space for regulation in the Western psychopharmacological model. I do see that as a place where I start to get friction in this is that being held up as the way to do things. So when I first approached psychedelics, it was because of my experiences in the mental health care system were a failure. And I came into it from a place of desperation. I've tried everything else. I need some help. And this became the thing that as I learned about it, presented itself as the miracle cure. That isn't the way my experience went. And if I hadn't encountered these substances the way I did, I don't know what the trajectory of my life would have been like. But I didn't have access to them in a psychopharmacological model nor would that necessarily work for me. And I have a lot of people that I know personally who, because of the way they view the healthcare system, have had really amazing experiences in that Western model, and that's what they would be comfortable with. And that should be regulated. I do want, again, that discussion of where are the other spaces to have a community-based model, a shamanic model, a wellness model, or whatever all the other models are, talking to each other. And that is beyond the scope of, for my read of the regulations, that is beyond the scope of what they're trying to do. They're really ideally trying to regulate that one piece, but not elbowing everybody else out of the way. That would be my hope. That is a very different conversation, because now we're dealing much more with Health Canada and either decriminalization or legalization that does not require medical intervention to get access to these substances.
There's an interesting question about what was the motivation for creating the regulations, and nobody's removed it. So I'm just gonna, throw that out there. We'll follow the money. Unfortunately, it's driving the forces of this as well.
Couldn't help but notice that psychotherapists and counselors in Alberta cannot provide psychiatric assisted psychotherapy. Any comments around that? And that's kind of I think the gist of the conversation thus far. The leaning into psychiatrists being the ones who need to sign off from a prescription side and a supervision side create a bottleneck on top of a bottleneck that already exists with psychiatrists.
And further to that too is with them naming psychologists specifically. Well, the vast majority of traditionally trained psychologists utilize CBT, so cognitive behavioral therapy. There is zero use of CBT when it comes to interacting with psychedelics. Mm-hmm. We're dealing with a medicine that opens up your construct, pushes you past who you know yourself to be. And now you're asking them to track their thoughts or to work backwards with their thoughts. So again, further to the nearsightedness of these regulations, that is not a set of credentials that qualify you to deliver psychedelic assisted psychotherapy. It's a background of experience, I think, personal and professional training. So yeah, counselors, I've got some phenomenal counselors that are providing incredible relational therapy in conjunction with psychedelics. And with these regulations, they won't be able to do that anymore. So I'm finding psychologists that can, and social workers who can. And I'm on many, many weeks of doing interviews right now.
Yeah, the training in their advanced course, having conversations with third wave therapy like ACT and IFS, and these are the models that really are working effectively with psychedelics. And that's not the typical medical model.
I think it's worth noting also, speaking of psychologists, the regulations are really dealing with the substance and the use of the substance itself in practice. Is it correct to assume that a psychologist who is doing conversations around someone preparing for a psychedelic experience or integration post-psychedelic experience, that psychologist or therapist or counselor was not personally involved in, that's not affected by this?
We don't know.
It's not clear.
What is the impact of that lack of clarity? Personally and professionally, I would say.
I'm very grateful we don't have a clinic, is all I'm saying. If we were in the clinic space, it would be very, very difficult to know where next week is, let alone next year. But in the education space, the education requirements for this program are such that the psychiatrist can dictate what that education is for the therapists that are under one of those 6 colleges. And so that has played really well for us. So it's almost like this bill, as far as APMA goes, it's beautiful. It's great. My thing is accessibility for the public. And so if I was in clinic space, I would be very nervous about this.
Yeah. Part of what I'm seeing is I've got doctors that were set to run my accessibility stream. So this is accessibility for people who need this, who can't afford it. We have that up and running, but with these regulations, it's not super clear. Can these doctors who have 3 years experience, not 5 years experience, can they actually run my program that we have, right? Under the regulation, it looks like it is up to our medical director to determine that. But at the same time, this lack of clarity has my doctors nervous, unsure. One has backed away and now gone back to palliative care. And it's creating a lot of unnecessary angst in healthcare providers, and it's delaying access.
Simon, what about for you? Like this uncertainty in something that clearly has had in trial results in end of life anxiety care, having this uncertainty around it. How has that affected you?
I think I still need to, again, agree with what's already been said. I do think these are powerful drugs. I do believe that some guidance is important. Personally, for me, I do get asked quite a bit, what should I do, and should I take, of course, people can go online and get these medications as well, and I feel really conflicted, because I do really feel set and setting is paramount. You can do a lot of damage if you really don't know what you're doing. And I think going to a forest with a bunch of your friends and taking psychedelics is not a good way for many people to experience it for the first time. And so I feel conflicted, because I do see that it can be extremely powerful and effective if handled in the right way with people who are experienced. And I think what people are saying, in a safe space, it's about safety, right? So people need to feel safe. So as a physician, it's tricky, right? Because I know how effective and how life-changing they can be for people, particularly in our population with a very short period of time left. And that's something we haven't talked about, is that if we have barriers or guidelines for someone who's got maybe a few months to live, that can be a huge problem. A few weeks is a massive amount of someone's life if they've only got a few months to live. So, I'm really interested to and hope that the guidelines make, particularly for our folk, the people suffering from palliative, that it's easier. And David probably can speak a lot more to it than I can, but it can be very anxiety provoking waiting for SPAs and different things to come through for someone who's got a very limited time left on the planet, and I think, I always feel people should have the access to treat their existential suffering in the way that they feel is important to them. And I just see so much suffering, and I know that there's a huge amount of good with some experienced practitioners beside you creating a safe space, however that looks.
Further to that, we had a client apply for Section 56 back when they were being granted, and it took so long that they chose MAID instead, which that's just heartbreaking. And it wasn't somebody that was going to be imminently dying in weeks. It was, months of prognosis but it was just the existential anxiety. It was just too much. So they opted out.
This is a good question to slide in here. As a spiritual health provider in a large hospital, I'm curious if there's much conversation about the inclusion of spiritual health providers that are already working in the hospitals with specialized training to sit with existential suffering into the conversation around supporting the medical teams, such as palliative care, in sitting with clients utilizing psychedelics via things like the SAP program.
That is not currently happening in palliative. We have difficulty enough getting access to enough spiritual care. And as far as I know, certainly speaking to some of the spiritual care people that I work with, I know that psychedelics is not something that they're necessarily discussing, not that they are against it, but I guess they're waiting also for guidance. But I'm a huge believer in having spiritual care for people. But then, of course, there's also the misunderstanding between what is religion and what is spirituality. So some people don't necessarily wish to connect with spiritual care because they see that as, they have certain thoughts around that. But it's not currently happening, as far as I know, in Alberta, certainly in a professional way, at least.
I think to Tanya's point, I know the Roots to Thrive program, there's a lot of spirituality that's so in conversation, yes, in regulatory conversation, no. People that are doing this medicine, there's a lot of really, really good work happening above and below ground.
One of the questions that I've heard a lot and that I really wanted to get into tonight is great, these regulations are here, but what can people do? And so often in these kind of discussions, the standard answer is, well, email your MLA or call your MLA and give them your opinion. But this question maybe delves into that a little deeper. Given the present issues regarding the regulation of psychedelics, what can actually be done to ensure a healthy future for Albertans, say 20 to 40 years down the line? Who needs to stand up so that this field can be shaped correctly? What can we learn from what happened in the 60s and 70s with psychedelics to inform people in power in Alberta and Canada who are wary of a Timothy Leary type figure emerging?
That was really the driving force, partly in the regulations, talking to Marshall Smith, who was part of that. He said, we don't want to have clinics opening up with, how did he put it, dream catchers in the window. And we just want to avoid that like the plague. So there was a very much white wall clinic driven model that they were trying to avoid that spirituality side completely in these regulations. Yeah. That doesn't directly answer it. I can leave it to the other two.
I just keep coming back to multi-focus backgrounds, multi-practitioners, wider scope, not just 10 people sitting around a table from similar backgrounds.
Plug at the end, but I can plug now too, is when people are unsure of what to do, aligning with groups that are taking action is one of the ways to do it. So the Psychedelic Association of Canada, for example, is doing formal advocacy work in order to have communication with Health Canada to create things like on our website under the About page, there is a code of ethics, creating content, creating these discussions, working with different levels of government, working with industry to have these conversations to continue to move things forward. So the barrier of, well, what do we do in this particular case? Email your MLA, that is unsatisfactory. So how do you take the energy of conversations like this and actually take action? One way could be, if you haven't already considered joining the Psychedelic Association of Canada or organizations similar to it, where you can connect with other people who also have that same energy and find out what are the steps that we can take. So building or joining community of people who are aligned the same way as you, and start to have those one conversation and the next conversation and the next conversation that ultimately could result in policy change.
And take training. There's always training. Like seriously, it's coming, and many therapists have never ever done this experientially before, and that's why we have spent so much time and money pushing against the wall to get a clinical trial approved with Health Canada so that we could provide experiential training. It's just, to me, it's not an option. The Roots to Thrive is another great program on the island. What Pam and Shannon have done there and their team, it's absolutely brilliant. Experiential learning in group therapy, just incredible stuff that's happening. So make yourself aware of what's going on. There's a lot of stuff happening in the space of it legally being able to experience what these things are like.
This question came in way at the beginning, and I've been trying to find an opportunity to slide it in. Does anyone else feel that some of this needs to be a component of basic medical school? Personal experience, psychiatry and psychology is taught from such an archaic perspective. And so at what point should we expect physicians to understand other approaches to substance use, such as harm reduction and community approaches?
Yes.
Wow, that's a great question. But I will say, I will put a shout out for University of Calgary at the moment, who are doing a reimagining of the medical education and involving racism and poverty and homelessness, and it's quite it's quite interesting what's happening in the medical school. So I've been involved in some of that from a health equity. So they want to really start to incorporate a lot of the trauma informed care, and but medicine is it's a big ship that takes a long time to turn. But at least this is a start. So yes, you're right, a lot of these concepts need to be discussed, and there's a lot of interest from students, medical students, who have heard all of these before they start medical school. So learning about psychedelics in medical school, that would be fantastic. I think that time will tell. Of course, if it becomes mainstream, then of course that will be a part of pharmacology and what you'd have to know. But yeah, I think we could do huge amount by just trauma-informed care and increasing our understanding of that and harm reduction. And but watch this space. There's some good stuff happening.
It was pretty wild to watch my docs and my psychiatrist, because we do experiential training for our clinicians, because I think it's so important that we have an idea of what's going on. So we do it not only once, we do it multiple times. We also train our docs, our psychiatrists, our medics in relational therapy aspects, so that they're involved the entire time. They're in the group room with us the entire time. And watching these docs before they had experienced ketamine and after, night and day. The way that they interact, the way that they prescribe, the way that they assess, and the way that they collaborate in our rounds discussions, it's been really quite pivotal for them to have that direct experience.
Might sound like a crack at the system, but I think it should be required as an entry point for anybody going into medical school in any way. Knowing the medicines, knowing the systems, I'm going in to do this to help people, and this would be a really good rite of passage to do a 5-gram mushroom trip. But I speak from the sidelines on that one.
The sideline conversations are interesting. I think that in a lot of these conversations, particularly when we get around regulations and education and curriculum and all that stuff, we're talking about things at a deeply systemic level. And what it doesn't necessarily allow for is viewing things that are on those sidelines. So, personal example, my oldest daughter is in second year university and she's taking psychology. And we have for a couple of years now been having conversations about what my lived experience is. And so if I put myself in where I was in my life when I was her age, it's a fundamentally different place where it was fully immersed and entrenched in the war on drugs, and drugs are bad. And you take it once and it will kill you, or you'll become an addict. And the world that she is experiencing in her formal education, as well as being aware of at least my personal experiences and the openness to have conversations with her friends and her colleagues, is just a fundamentally different place than the one I grew up in. And so it's kind of like, it's a moment of the kids are all right to a degree, that this is in the zeitgeist in a way that it hasn't been in decades. And that gives me a lot of hope to say we don't need to change the direction of the ship immediately, because there are people coming behind us who are going to pick up that baton in ways where this will be such a no-brainer. It's the immediate term conversations. And Simon, I hear your frustration when people have weeks or months and these kinds of regulatory discussions are getting in the way of that from a timeline perspective. It's an incredible frustration. Long term, I'm much more hopeful. Shorter and medium term, that's where these conversations become really important in terms of where do we actually affect change.
Yeah, I think I would agree that 5-10 years from now, we'll look back at this and wonder why we were so uptight about these regulations. Things will change and we'll get used to them and work around them. Somebody said, whenever there's a cement wall, there's always a crack somewhere that you can work your way through. And these medicines are going to continue to be used in good ways around the world. But my goal, Peter was part of conversations about 8 years ago with us. And one of the things I kept saying is, when my sister takes medicine, then I'll know I've done my job, because she would not take anything if it's illegal or not considered moral. So that's the benchmark I've set for myself. Once I do that, I'll retire.
much of the conversation here rightly has been let's explore and examine these regulations and find the things that maybe need some massaging or need some rework. But there's an interesting question here. Is there any interest in collaboration with the ethical psychedelic international community in creating a model that could be adaptable to other provinces in Canada or other jurisdictions globally? So the idea of saying, hey, great start, here is a developed model that could be viewed as an alternative rather than purely criticism of the existing model. Nobody wants to take that one.
I feel like I've said too much, so I don't want to jump on everyone. The difficulty, obviously, is that every jurisdiction is not going to be lining up to go, yeah, we'll take that. Although Health Canada had sent representatives, in fact, the health minister to Oregon to talk to the people that put these regulations through in Oregon. So whether they're going to take notes from that and learn from thinking that's the wrong way to do it or the right way to do it, we don't know. But they're very observant of what is happening in the space.
Would have been fabulous if our government did that.
Yes.
What mechanisms, if any, are in place really to do that, to say, okay, this model doesn't work, let's build a different one? Is there a group or organization that is prepared to do that other than looking at what other jurisdictions already have? Sounds like a great opportunity for somebody to develop and fill a niche. We're down to a few questions remaining. We've still got about half an hour in our time. So if you guys do have more questions, please throw them into the Q&A. What more than an automated external defibrillator and a trained first aider do you think is necessary for safety with psychedelic assisted psychotherapy?
I'd like to take this one to start. Coming from a background other than clinical psychedelic assisted psychotherapy, I used to have a much more liberal stance on that. And now, having experienced what I have as executive director and therapist in Bloom, we only utilize ketamine here. There are so many aspects that are important considerations to take when it comes to delivering psychedelics to somebody. So it's emotional safety along with physical safety. There's so many areas of harm that can happen, especially for certain personality structures. And it's just not something that's talked about. We have this huge hype about psychedelics being a magic pill. And when I'm seeing these really struggling individuals come into our clinic, and some of them we can't serve because either medically, vascularly, especially with ketamine, they can't withstand the treatment. And that's where it'd be fantastic that we could then look at doing, psilocybin use. And then the other aspect is to be looking at psychologically, how stable are they? What is their background? What is their safety that they're surrounded with? And what is their sense of self? I've seen outside of this clinic, I've seen people get completely shattered utilizing psychedelics and not having the integration, not being able to understand what it is they just went through, not being prepared for what it is they're going to see and experience. Some people having the thing that many of us psychonauts go for is ego death. And when you have ego death and don't understand what it is, it can be utterly gutting. And it can set somebody off trajectory for a very, very long time. So there's many safety aspects that need to be considered. It doesn't have to be done in a clinical setting. It needs to be done with somebody who is experienced and educated in psychedelics.
Mm-hmm.
Talked about this one a little bit at the beginning. If I understand correctly, does section 37.2 allow for microdosing. It reads to me that a prescribed drug can be self-administered without supervision, where 37.2A1 specifies a drug other than ketamine in a non-psychedelic dose. And we said it's sort of maybe. But unfortunately, there's no real clarity. And this is one of the themes of the evening. The regulations have been put out, and there's so much uncertainty on how to interpret them and how to apply them that the only honest answer is we don't know.
Yeah, because it talks about a non-psychedelic dose, which those in the know would say that that could lean towards microdosing, but it's not clear at all.
It's very subjective too. What is needed for these treatments to be acknowledged as a sensible first choice for treatment versus forcing those that are suffering to go through the lengthy process of trying multiple pharmacological and talk therapy treatments that may be less effective?
Yeah, it's a massive shift in the regulators.
Is it fair to say that these are still viewed, like even despite these regulations being brought in and a glimmer of something changing, is there still a perception that these are a medicine of last resort?
That's what it appears to be, yes. And that is in opposition to Oregon's model.
That is how it's set up right now. Like
Even
our
the
doctors in our assessment process are always looking, have they tried other methods? It's a second.
One doctor applied for, I believe it was SAP, for treatment-resistant depression, and they were told they had to go through shock therapy before they'd be allowed to do this by Health Canada.
Someone is asking if we can post the website that has the new regulations, and there isn't one. There's a couple of PDFs floating around, but David, I think the website that you had in your slides.
Let me grab
them.
Just 1 second. I'll post it in there. Not sure how to get this to everybody, but
if you send it to Gordon, he can post it to everybody.
Can I chat directly to Gordon? Yes.
We're doing that. Another specific question of the regulations. Looking at section 37.4 in the regulations regarding where it can be administered, it notes a hospital, an accredited medical facility, which I assume is accreditation through one of the organizations listed in section 38. However, it also mentions the facility of a service provider licensed under this part of the Act. Noting that it mentions or on all 3 points. Are there limitations within any of the accreditation organizations or what could be considered a facility of the service provider that would prevent the ability to use a retreat style space or the space of a facilitator that is set up to support the more spiritual aspect of the psychedelic therapies? And I think this is similar to the what is a clinic question. We don't know.
Mm-hmm. It's a great question, though, because my personal belief is that the retreat setting is where the best healing can happen, which we're trying to do even in our clinical trial, is hosted in a retreat style format, group therapy in triads, so that it really does emulate real world treatment with psilocybin.
What can Albertans do as citizens to push insurance companies in Alberta to financially cover psychedelic assisted therapy? I live with fibromyalgia and my insurance company refuses to pay even ketamine assisted therapy.
I've had long talks with one of the insurance guys, and the big thing for them is back to work. So if the case can be made that these medicines are going to help people get back to work faster than putting them on basically drugs that they're going to have to pay for the rest of their life, especially with mental health, and the case can be made financially, that's when we're going to start to see the insurance companies budge. But the case needs to be made that it's going to save them money if they start prescribing these. The human element is not going to speak at all to them.
We've seen some clients have success when they've had their family doctor delineate the ketamine as the prescription and that prescription, and then the therapy separate. So some insurance companies will actually just pay for the ketamine because it's not that expensive. And then finding the areas of your insurance company that'll pay for the therapy. So typically it's separating them.
Are there age restrictions for these meds? Not in the regulations, but it's implied, I think, through the clinical trial process, which currently is only adults 18 and up.
Health Canada requires, is it 18 or 21? I'd have to look at our CTA. But I think it's 21 to 65. And so we've had some really good therapists that were seniors and that can't apply for the clinical trial, which is kind of silly, but it's just kind of an arbitrary thing that they have done with drugs, period. So I don't think it's intentionally targeting psychedelics, but right now there are age restrictions for clinical trials for sure.
In the broader conversation, there's a researcher in the UK named Ben Sessa who is of the position that it is unethical to keep these substances, if they're effective on adults, from kids the same way it would be unethical to keep chemotherapy from kids who have cancer just because they're kids and only restricted to adults. That's a much broader conversation and ties into the clinical trial process. So at some point, presumably there will be clinical trials with kids for treatment of these things, but that's probably a long way off.
And not so much, because FDA with the US and Rick Doblin said that they are required, if they have success with their MDMA trials, to do a trial for children. That's part of their CTA that they had to agree to. So it's almost the other way around, where the FDA was pushing it to be something that would be used with kids. At least that's what I understood from one of his talks. And they've finished phase 3B with successful outcomes. So it could be coming sooner than we think.
Tanya, I think this one is more for you. So ketamine infusion clinics can continue to operate even though they currently don't have licenses under the Mental Health Services Protection Act.
Yes, we're governed under the College of Physician Surgeons of Alberta.
Can you speak a little more to the concerns about the regulations as written right now, the potential impacts that could have on existing operations in Bloom or any ketamine clinic in Alberta?
Yeah, so there's some great ketamine clinics in Calgary, like Savvy Minds, for example, who are run by anesthesiologists. So they will now have to have a psychiatrist as medical director and have a psychiatrist overseeing all of the aspects. So there's a shortage of psychiatrists. I don't know if y'all know that. And let alone psychiatrists that want to dabble in psychedelics, further to what David was saying earlier. So what it's doing is it's limiting who we can utilize as far as credentials. And as long as psychiatrists are at the top of that chain, it's going to elongate the acceptance process. So even here, like I have 2 psychiatrists, and people wait until right now, middle of February, and we do not have high numbers. We're a very small, not-for-profit organization. We have small numbers, and we have people waiting weeks just to be assessed. Other clinics, there's a incredible psychologist, well-trained, well-versed. She's looking to open a ketamine clinic with a MD, and now with the regulations, they have to find a psychiatrist to oversee them, even though she is so incredibly experienced and the most educated psychedelic assisted psychotherapist I've ever seen. And she'll be limited in what she can do.
Thank you. Really good question here. What is the clinical trial that David Harder is referring to, and how do we access it for patients? We're going to put a link in the Q&A or in the chat to the Psychedelic Association of Canada website, which has an ongoing list of clinical trials that are looking for participants. And so keep your eye on that page. Check it from time to time as new clinical trials emerge. You can apply, and all those clinical trials will have their own independent screening criteria to determine inclusion or exclusion criteria. And roll the dice.
Yeah, ours is specifically geared to therapists for training purposes, although it is a clinical trial, which even Health Canada acknowledges that that's not the best way to do training, which anybody that's done trials. would understand that, but it's a N of 500 trial for the 500 participants, which again is not normal for a phase 2 trial, but clearly with the intention of training so that we can provide real world experience for therapists who want to learn what this is like.
Thank you. This one's fun. How about informed regulations based on evidence and with a focus on patient well-being as the standard? Why aren't we demanding that from all levels of government, given that they set the rules? An excellent
Join the
question.
tribe, Anonymous. That's what we're trying to do. Been having meetings with various levels of government in the past weeks. Another one next week with the opposition mental health minister or critic. It's the more you get involved, you don't need to be a doctor or any kind of title to call up your MP. And I know it only goes so far, but I believe the mental health minister right now, if he was barraged with requests saying this needs to be revisited, he is a reasonable ear. I've talked to him. Had some interesting days on Twitter the last few weeks, but highly encourage you to go after these guys. We can make a difference if they feel like their votes are at stake. That's what it comes down to. They want to get reelected in April. And so we can bend their ear.
How to handle this delicately. In an attempt to celebrate the democratic process in our country, when an election happens, there are usually forums or debates or opportunities to connect with candidates and raising issues that we want as individual humans, as families, as communities to be part of those conversations, to be part of those platforms. And in an election cycle, we get an opportunity to talk to more than just the party in power. What are the opposition parties wanting to do? I would be curious what conversations are possible at the NDP level. You mentioned David talking to the health critic. What opportunities are there for people now before we're in an election cycle to go and talk to their potential candidates for their riding, if they can find that out through the party, to say, what is your party's position on this particular regulation? What is your party's platform on psychedelic assisted psychotherapy? And that is probably a different, not necessarily easier, but different conversation before an election for a party that's not in power than it is for the party that is in power.
I emailed the mental health critic, and an hour later I got a response with the request to meet. It was that quick.
What's their name?
They want to know. NDP, the NDP party in Alberta. She was Riverside, the mental health critic. I'll look it up quickly. I can give you the name.
And it sounds trite, but look up who your MLA is and contact them. The worst they can do is not respond, really.
Yeah, like you say, we're in a time when they're listening. They're all campaigning and trying to figure out how to either take over or retain their seat.
In the USA, there are clinics that offer at-home ketamine therapies. What needs to happen for this to be accessed in Canada?
There's Zoom clinics.
Yeah, I'd like to jump on that one.
Please do.
It is already happening in Canada. So any doctor can prescribe ketamine. These regulations specifically allow that to continue to happen. And I'd like to let the public know that we are seeing serious consequence of these clients now being cut off from the prescribing doctor. They're coming to us trying to access ketamine because now they are dependent on it. They have grown tolerant, so they're taking really high amounts that are now bordering into having permanent bladder damage that happens from taking ketamine on a regular basis. So the regulations, the area that I believe that we need to really have education and better understanding is in that area of prescribing for at-home use. To send someone ketamine lozenges without any kind of instruction or follow-up is, in my opinion, a recipe for disaster.
And that speaks to potentially another gap in the regulations. Is it's not just the substances that that are mentioned, there's nothing in there about dosages, and particularly this idea of a non-psychedelic dose, nothing that we know of about what that dosage is. So we don't have a minimum amount, but we also don't have a maximum amount. Is there a sense of, if it's psychiatrists who are going to be prescribing, do they have awareness of knowing how much to prescribe to a client or patient rather?
There's not clear guidelines, like, so from the CPSA who we report to, there aren't clear guidelines on that. So what we've done is we went back to all the research. We've collaborated with like other clinics, Roots to Thrive, Savvy Minds, Wayfound, and we discussed those limits. You know, I just want to go back to that other question about the at home. The one thing the regulations are actually restricting and making more challenging is the very aspect of what is needed with the ketamine is that psychotherapy component. And so that is what it's targeting. And so now we're going to restrict these family doctors who are in, you know, for a lot of them, they're in their very best interest prescribing this ketamine to bring some relief for people who are on serotonin medications, and now this is working on a different pathway. But if they aren't able to provide appropriate psychotherapy with it, which is restricted in these regulations, then that's a huge disservice.
There's a question that I was hoping to get to and sneak in. Can a nurse practitioner prescribe these at all of these regulations? I would think this would be an option, given that nurse practitioners or an MD can be involved in MAID as an example. And the answer right now is either no, or we don't know.
No, or in consultation with a psychiatrist, I believe, would be the same as an MD, but I don't know that for sure either.
And then we get to, what does in consultation mean?
Mm-hmm.
Who knows? It's a question I really want to get to, but we're not going to get to it in this one. We've got about 10 minutes remaining, or 9 minutes remaining. Last call for any last minute questions that you all have. Is there anything that any of you on the panel has come up for you that's a really burning thing that you want to speak to but haven't had the opportunity yet?
Yeah, I'd like to start with just saying it sounds really negative tonight, and I want to put a spin that I do believe, like looking back 5 years from now, we're going to look back at this was a step forward, even though it seems like a step backwards. And so to your point, Peter, I know you were pushing this too, that we're talking about it, and that's a good thing. And we're actually having these conversations. And I believe the government is listening, not the way we'd like all the time, but we're having conversations with them, and they're actually taking meetings. And I feel like 5 years ago, we had no pathway. We were having conversations and talking about starting Catalyst and doing stuff that the only thing we could do was talk about it amongst ourselves. And even the medical community, it was hard to get the ear of any doctor, psychiatrist, psychologist. They were just like, no, we can't talk about that. That's illegal. And now the field is open. You can talk to almost anybody on the street, and they've heard about something to do with psychedelics. And the Alberta regs have really raised that conversation. So I want to say, to your point too, Peter, that the positive side of this, I feel really optimistic about where this is going. Very concerned about the Alberta regs, but optimistic on more of a global scale, that this is moving forward in a beautiful way. And I'm not a tree, I can always move.
Would a patient from Alberta, actually, before I get to this question, again, I'll take off this sort of facilitator hat. When I got involved personally in this space about 5 years ago, the kind of conversations that I was having at the time were very different from what they are now. If someone had told me 5 years ago that I would be sitting here having this conversation with these people, there's no way I would have believed it. But my entry into this world started with conversations. It started with monthly meetup groups. It started with having the conversations and showing up in spaces where these conversations were having consistently. And so more than government advocacy, more than what's the lobbying option, what's the petition, it's having the conversation, and every conversation moves this needle. And this is, I laugh when I say this, because this is something David and I have talked about for years, just as knowing each other personally. There is no insignificant conversation in this space. every time I am personally open with someone about my story, about my willingness to say, yes, I have explored these substances. Yes, here's how they have helped me. Here is the way that they have informed the way I interact with my family, the way I do my work, the way I wash the dishes sometimes. Every time I share that story with somebody, I'm willing to take the risk of their judgment or consequences to employment. Something shifts in the culture, something shifts in my community. And that would be my one hope for people wondering, well, these regulations are awful. What do I do? These regulations are a starting point. It gives us an opportunity to initiate conversations with people that maybe we would never have talked to about this. And I see a lot of hope in that. I see a lot of joy and opportunity in that. And I personally will not stop talking about it, even though probably my wife is sick about me talking about this stuff sometimes, because of how it's affected me deeply. And that underneath all of this conversation about regulations and government advocacy and legislation is, this is helpful for human beings, and it's an obligation of mine to continue talking about it. And I would invite everybody else to do the same. Any last words before we wrap up?
I think I would just like to say my journey started a long time ago with Atma's very first therapist training. And that was my introduction to psychedelics. And I came out of that and realized how much experience I needed personally from it. And I deep dove. And because of that, I'm now in the position that I'm in. I'm on this panel with you all. And I really want to thank you. Thank you so much for all the conversations that you've been having and everything that you are doing to pave the way. And I believe that psychedelics are a very powerful and brilliant medicine that we in mainstream society have a lot to learn.
Simon, any last words?
Yeah, I think I reiterate. Sorry, my phone went off. Apologies. I think I would like to, agree with everything that's been said. I think it would be great to have some clear guidelines. I think the evidence certainly coming out for psychedelics and the power of psychedelics is, unquestionable. I look forward to hopefully more multidisciplinary, because I do think that is a very important part of this. There should be multidisciplinary meetings to any guidelines. But I look forward to, as a physician, to be able to help people access this, because I think the evidence is growing and mounting. It's we just can't ignore it anymore,
Thank you.
Yeah, and give a shout out to Dr. Lyle Galloway and Simon. There's a few docs in town that have, before it was cool to talk about this, they were exploring this with us and willing to carefully put their neck on the line in terms of, yes, we need to do this. And sitting with our palliative patients, Dr. Ravi Baines, just so much compassion he had for people beyond just, here's a pill. And he would follow up, even our first client, Tony, that very first one in Alberta to do psilocybin legally. The story behind the scenes was that Ravi spent a lot of time with him. It just wasn't a 4-hour treatment. It was a protocol of therapy. And so there's people with so much care. Even looking in the room here, I see names that just for years have been doing this work and compassionately sitting with people, very practically just helping us, like has been said many times, just walking each other home. And so it's a really cool space to be in. I find the community kind of like what church was meant to be, what I was told church was, and oftentimes what church was, but a really place of caring people that really look out for each other. And it's been really, really an honor to be part of this community.
Thank you. So that's our time.
Thank you. One more thing. You're not a CPA member, PAC member. I'm not inside the track, so I can speak objectively. Join up. They need your support and they're supporting us. So it's a win-win.
Absolutely. So thank you for being here, Tanya, for your participation and walking us through the impact on ketamine clinics, and David for your walking us through the regulations and providing that perspective, and Simon for talking us through the deeply personal impacts of these regulations on people that are amongst our most vulnerable. It's very, very much appreciated that you were willing to give of your time, and for Gordon helping us on the back end, and Cheryl as well. Thank you, everybody. And for all of you for showing up and taking the time to be here live or to watch this recording. We appreciate very much the time that you've taken to be part of this. If you go to the Psychedelic Association website that Gordon has just posted in the chat, if you're interested in contributing to the CPA in some way other than being a member, we're always looking for volunteers in varying capacities, and we would love for you to join us and maybe participate in some of these discussions in our webinars. Don't forget to reach out to Cheryl, our community manager, or Jay Katz, our executive director. Both of them would love to hear from you with any questions, suggestions, ideas for how the Psychedelic Association of Canada can help continue to move this work forward, not just in Alberta, but across the country. And yeah, as David said, if you enjoyed tonight's experience, please become a member of the PAC, and you can have experiences like this all the time.
And
come to Calgary, while also supporting our work. Just go to psychedelicassociation.net, and there's become a member, a link right there. So thank you for Gordon as a volunteer, and all of our volunteers who make this possible. So grateful for all of you. Thanks for coming, and have a wonderful evening.